So here we are. We're at the near the finish line here. You've got to make some decisions now with all the information we've given you. So what the heck do I do now? Well, first off, you're taking the first step, obviously. You get yourself educated. As Paul talked about, there's the Medicare and You document. It's a big book, probably 100, 150 pages, that goes through all this material related to Medicare. Very, very informative, and they keep it updated every year to learn about the different options you have. And then you have choices of plans and carriers and all these different, what ifs that you unfortunately have to go through. So, and as we say there, it limits the flexibility. So the decisions you're making now can potentially limit your options when you're not 65 or you're 75, 85, et cetera. So, decision before the decisions. What you need to do is when you're turning age 64 and approaching that critical 3 months beforehand initial enrollment period, you need to sort of figure out, what am I going to do? How am I going to handle all this, decision making that I have to make? So you have two options: do it yourself or seek advice from an expert. If you're doing it yourself, you need to get really smart really quickly and decide whether, as Paul and John were saying, going with a Medicare plus a Medicare supplement or a Medicare Advantage, which is right for you. And remember, when you were on Chrysler Insurance, you did a family plan. Medicare, your decision and your spouse's decision can be totally different. It depends upon your medical situation. Also, kind of going back to Social Security, even though Social Security is individual, there is some jointness with spouses and divorces and things like that. So I don't remember whether Paul mentioned it or not, but if you're going on to Social Security, I really advise you to be talking to the Social Security office and making an appointment with them, first going on the website of Social Security and getting your particular information with not only how much money you contributed to Social Security over your lifetime, starting when you had a paper route or worked in McDonald's all the way till now. It's got all that data, and what your benefits will be at age 62, 65, 68, 70. All that information is on there. So get a Social Security website or ID and password and account. But also I would recommend setting up an appointment in one of the local Social Security offices to go through your particular situation, because the Social Security options also can get very complicated. And once the decision you make, when you start taking Social Security, that is for the rest of your life. So, yes, sir.
Just to add what Howard said, if you make a appointment with Social Security, which I did, make sure you take your spouse along, because they will not talk to you about your spouse's Social Security situation. Absolutely. Unless that spouse is with you.
Correct. 1000% agree. So for Medicare, for your health insurance piece of it, you can do it yourself. And quite frankly, before a lot of these Medicare Advantage changes that have been happening, and now with and Part D changes that are coming over the next few years, as I talked to you about, this is a less preferred option, even though I think we all were very, involved people when we were in our work time and said, I can handle this. This is becoming really tricky. So that you can do it yourself, or you can go to an expert. And these experts, there are a few different options. First of all, there are many options. Lots of people will be, inundated. When you turn age 64, guarantee you will be inundated with mailings. Everyone knows in Washington, D.C. how old you are, and that information is public information, and they sell it to the insurance, or sell it or give it, I'm not sure, to the insurance companies, and your mailbox will be stuffed with all of these flyers with, you to use my option, use my insurance policy or XYZ insurance policy. So to try to wade through all that noise, both Stellantis and NCRO have some recommendations. As I mentioned to you before, there is a federal program called SHIP, which is the National State Health Insurance Assistance Program. This is a federally authorized organization that has state or departments or state areas that are responsible for Michigan, Alabama, Washington, D.C., Washington State, Maine, Florida, Hawaii, etc. So in Michigan, that is called MAP, M-M-A-P, Michigan Medicare and Medicaid Assistance Program. This is a federal program. It is staffed. The people you'll talk to is staffed by volunteers. And you can even, if you're really into this stuff and would like to get involved, you can volunteer also and be a consultant and work with people your same age in trying to win their way through this maze. So that's one option. Those people, as I said, are volunteers and they do not get compensated. And then there's another option, which is going through these insurance agents. You don't pay anything out of pocket for them, but they are not compensated. They are compensated by the insurance companies. And they have different insurance companies that they contract with. So not all of these consultants will cover all of the different insurance companies that you might be interested in. But we, NCRO, have some recommendations that we have vetted, and two of them are in the room right now. One is Butler Capital, and Dave Baum is in the back of the room here, and his partner is Denise Sikorsky, and they're out of Toledo. Yes, John? And MMAP is here. Oh, yeah, excuse me, thank you very much. So MMAP is in the, or MAP, I think they go by instead of the double M. But MAP is in the back of the room, and the woman, our consultant here, or the coordinator, is Sharon, and Sharon will be able to talk to you and after the meeting here. But then, as I said, we have some insurance agents here, Butler Capital, Double Health USA, which is represented by David Key. He's in the back of the room. And we have another consultant. Her name is Laura Camacho. She's out of Texas, but we've had some good experience with her. Now, those are the ones that NCRO has vetted. FCA US in Auburn Hills have two other options available to you. Via Benefits. Now, this is viabenefits.com, not Via Benefits Accounts. It's that different department, as I said. And then another organization called AmWins. And I'll go through each one of them individually very, very briefly. But we have a slide here for MAP in Michigan. As I said, a grant-funded, nonprofit, not affiliated with any insurance company, impartial, comprehensive, confidential services, and a phone number. And they're a part of this SHIP organization for Michigan. We also, if you're on the webinar and out of state, there is a SHIP website that you can go and put in your zip code or state and whatever, and find out the equivalent for MAP in your particular state. They also have elder care. There's also other organizations, Area Agency for Aging, which is another organization through the federal government that will help you with not just this insurance questions, but as you're, do you age in place? Do you go into assisted living facilities? They're a wonderful, wonderful resource of lots of aging information. And NCRO even has a tab on our website. We have a whole aging subcommittee of 2 or 3 people, and Dale is part of that over here, one of our staff here, through NCRO to kind of guide you through some of the area agency for the aging. And they are also got a federal presence, but then each area in the country, and I think there are even 2 or 3 or 4 agencies in some of the larger states that are specific for the area, and you put in your zip code, and it will direct you to the right place. We also have a slide here for Butler Capital with Dave Baum and his partner Denise, and their pictures there, and it gives a little write-up of what their services are. We also have a slide for David Key and Double Health USA. We also have a slide for Laura Camacho and what her services are. And Via Benefits. Now, Via Benefits is a little unique in that because they are part of FCA US, and they're sponsored by, not sponsored, but endorsed by them, they get access to your Chrysler information. Also, another thing, just so you know, if you ever contact NCRO, us, we know nothing about you as an individual. The Via Benefits accounts and Benefit Connect, they have access to your personnel information like a personnel department would. But if you ever contact us, we only know your name and whoever, and your email address. We can help you wend your way through some of these questions, but we, as I think was mentioned earlier, we have access to the HR department in Auburn Hills. So if you've stumped the chumps over here, we can go and talk to our people in Auburn Hills, and they're the ones who contract these companies, and they can listen to the recordings. They have all access to your information. So if we get stumped, if you get frustrated and we get stumped, we can talk to our HR representative and hopefully, knock on wood, get those problems addressed. Now, the reason I bring this up is Via Benefits, they get access to your information. So you will get information from Via Benefits with FCA's logo on it. And like every 2 or 3 months, you'll get a mailing. Hey, you're getting closer. You're a year away from age 65. You're 6 months away from age 65. Here are some decisions you want to start to make. So they basically give the same benefit as any of the other consultants. They really are no different in terms of the services, at least in my mind, and you can look at the different services they offer, but they have it's the same equivalent kind of company as Butler and as Laura Camacho and as Dave Key in the back of the room. But they are endorsed by, as you can, just notice on their website that they say, it says viabenefits.com/FCA. So they basically have customized things for FCA, where the other people you will get in the mail are just, because you're age 64, they'll start sending these mass mailings out. There is another option, and this is a company called Amwins. Now, this was created back, Rich, when was this done? Yeah. So 1990s, so 2005, 2015, almost 30 years ago, this was an arrangement that Chrysler at the time made, saying when they take your, they used to, for people who were retiring back in the 1990s, they used to get what's called retiree health care. And Chrysler continued to pay out monies with a, basically a wraparound insurance policy over and above Medicare. But that stopped in the 1990s. So what they did was they worked with this company called Amwins, and they created an equivalent insurance plan which mirrored the benefits that you got under the old Chrysler healthcare that you had. So this is still in existence. And as you can see, they have, and this is, purely Chrysler unique, but they have supplemental insurance, 2 health or drug plans, dental plan, vision plan, et cetera, et cetera. Here, 1,000 employees in 2007. Okay. So they are very, very comprehensive. The only thing is they're pretty expensive. so that you will be getting from FCA and from AmWins a package of material. And all this information, we have a copy of that material. And for all these so all these companies that I've just shown you, we have one slide per. But on the website, we have a multi-slide presentation from each one of these consultants that you'll be able to look at to get more information. And obviously, you can call them yourself and talk to them personally. But AmWins is another option, but as I said, it is pretty expensive. But at the same time, depending upon your health situation or that of your spouse, it might be something you'd want to look into.
The AmWins plan has no underwriting. It's a group plan for Chrysler. So it's similar to an Advantage plan in the sense it has no underwriting. What some seniors has found when they get up and older and they're paying a lot for their Medigap plan, this is an option because there's no underwriting, but the premiums are, well, you'd have to look them up, but they have a couple different plans. It's worth a look if you're older. I would not advise it to anybody younger because it's just more expensive than anything else you can get. It's worth a look. They have some co-pays and their drug plan is extremely expensive, but they are on our website and you can go there and you can see how much they're charging. But the only advantage I see to them is the fact that they have no underwriting.
But because of the no underwriting, they have a lot more risk. They have a lot of high cost people, and therefore that's why the premiums are more expensive. So, you know, it's your option. Obviously, there's no barrier to entry, but it's costly. So, once you've figured all this stuff out for yourself and decided what you're actually going to do and figured out which insurance company you've got, okay, I'll get there in a second. You'll need to fill out enrollment forms with the insurance company. You'll start paying premiums directly or set up an account or an ACH so that they can bill you. Some of these insurance plans are zero cost, so you don't have to worry about that. And you'll receive a Medicare card and then another card, very possibly for all these supplemental insurance plans that you've got, and you put those in your wallet. And then what you'll want to do probably is go on these websites and set up a user account, because then you can start to see your claims rolling in and your copays. And if you remember, you know, as you're currently getting, you know, EOB's explanation of benefits and the whole shoot and shebang of, you know, what you get right now on your regular insurance plans. Good luck on your decisions. So did we have any more questions? I saw Dale gesticulating here. Are there any questions? No? Oh, there are questions from the web. So what do you got there, Gordy? Are there any questions from the web, Gordy, that you can see, or are we ready to wrap it up?
Somebody wanted to see the Laura Camacho slide up.
Scroll back to Laura's.
I can do that. Whoop, there she goes. Now, if you notice, Laura says representing 20 carriers. She's listed 8, 9, 10, 11 of them and more. So each one of these insurance companies, you know, they are insurance agents. They are there to make a profit, and therefore they have arrangements with different companies. And you can go on the Medicare website and see all the options you have. So you might have 30. Whoa. You're doing that? You're driving?
One more. It says, will NCRO email its members that this material is now on the website?
I'm sorry, say it again, Gordy.
Will NCRO email the members when this material is available on the website?
I don't think so. I don't think we're going to send a mass email. Put it this way. What's on the website right now is as of last year, and it's, you know, it's, as I said, it's 90 to 95% accurate. The update will happen over the next few weeks, literally as we get around to it. And that'll be then 100%. It'll be identical to what you're seeing. But what's there right now is pretty close to the same as what you're seeing.
One more. Do you recommend a consultant from your state of residence, or is a a national, consultant okay?
So there are state laws, and therefore the consultants do handle multiple states, but they might not handle all the insurance companies in your state that you might want to use. So that you might want to shop around. Not only are you shopping around for insurance companies, you might want to shop around for consultants, because different consultants might have different options. And then because they're insurance agent, they have to be licensed also. John is right. Yeah. Yep. Any other questions from the web, my friend? Nope. Any other questions from the room? Nope. Well, thank you very much, everyone. Thank you very much. Hopefully we didn't, I know it's literally it's drinking from a fire hose here. It's a lot of information. I'm sure you absorbed maybe half of it, but all this information you'll be able to see on the web, and working with the consultants, you'll be able to wade into this whole minefield of Medicare. Thank you very much. If there are other questions coming from the web, we will get them from our web gurus here, and we will answer them. Yes. Thank you very much.